Hello, this is Dr. Steve Horwitz from Dallas Sports Academy. There have been a number of articles in the media with regard to the too much exercise hypothesis, meaning endurance athletes and potential complications with the heart. So this is the most recent paper in the current Sports Medicine Reports, January, February of 2017. And it talks about the, quote, dose-associated response of physical activity and cardiovascular outcomes. The bottom line is, if you're out of shape, you have a greater risk of issues with your heart. There have been some studies with marathon runners that look at a particular protein in the blood, and that can be a problem if the number is too high. However, what the studies show is although the numbers will go higher post an endurance event, it is a short-term increase, meaning the numbers go back to normal very quickly, so it doesn't appear to be an issue. With regard to long-term cardiac complications, there are some interesting studies with regard to myocardial fibrosis, meaning scarring of the heart tissue, where the scarring can go up with long-term endurance activities. The other issue is coronary artery calcification. So that study was done in Germany with runners who did 5 or more marathons. And in that group, there were some issues with increased calcification. Also with atrial fibrillation, they looked at Swedish cross-country skiers, and those who were at the ultra-fit, ultra-endurance side did have an increased risk for atrial fibrillation. Those who did moderate activity had a decreased risk of atrial fibrillation, and those that were very low on the activity scale, meaning those that didn't participate in cross-country skiing, those had an increased risk of atrial fibrillation. So there we have it. What's the bottom line? Do your workouts, enjoy fitness, stay fit, and just think about a good exam if you're one of those that really bring it to the next level with your endurance activities.